We begin right now at 5 o'clock with breaking news on the coronavirus outbreak. Good evening and thanks for joining us on this Tuesday. I'm Dennis House. This has been a day of swift moving developments in the coronavirus front. The governor has declared a public health emergency here in Connecticut, and this gives him the power to take quick action to protect our state. So here are the headlines for you tonight. There are now 2 confirmed cases in our state. Region 14, that school district there, is closing schools until Monday after a student came into contact with a coronavirus patient in the town of Bethlehem. And winter high school sports tournaments for the entire state have all been canceled. We begin with Channel 3's Susan Raff, who was with the governor today at the Emergency Operations Center at the O'Neill Armory in Hartford next to the Capitol. Susan?
Dennis, those 3 words are very important: swift moving developments. The governor used those same words in his press conference today to show and explain exactly why he's declaring a state of emergency. It does allow him to close buildings, use the military. It also allows the Attorney General to crack down on those who are charging exorbitant prices for things like face masks and also hand sanitizer. But this is the focus today at this press conference. The governor is going to close as a result of a coronavirus case, the second case in Connecticut. A woman from Bethlehem, the school district decided to close the school because of the fact that this woman may have come in contact with children who go to that school. The school will be closed for a few days. The hope is having it reopen on Monday so they can clean 4 buildings. The other thing that came out of this press conference today, they want to ramp up testing at the state public health lab. Right now, they're only doing about 19 to 20 tests a day, and the goal is to do between 50 and 60.
One thing has come crystal clear to me why it's important that we have this emergency declaration is it gives us the opportunity to get more testing capacity faster for all the people of the state of Connecticut.
We have reached out to the 27 hospitals in the state in regards to whether or not they would be on board to look at sampling and testing. And I'm glad to report that everybody's in this together, so the hospitals have said absolutely.
The Department of Public Health says 56 people have been tested so far here in Connecticut. 2 have tested positive. 19 are in the queue. That means those are the cases that are waiting to be tested. That's of today. And again, the goal is to ramp up testing between 20, which is done now, to 50 and 60. In order to ramp up testing, they will have to hire 7 additional people at the Department of Public Health's lab, and they're also going to do more training. Hospitals have also been part of this. In fact, 10 hospitals in Connecticut will now have trailers outside their hospital to do sampling and testing, and the priority with that, or the concern, is that they don't want those people going into the hospital and possibly infecting others. The governor was also asked today if he's perhaps overreacting to this situation. Connecticut has only 2 confirmed cases. New York certainly has a much bigger problem on its hand, but the governor said it helps to be prepared and he'd rather act sooner than later. We are live at the Emergency Operations Center in Hartford. Susan Raff, Channel 3 Eyewitness News.